Well, the World Health Organization has activated its highest alert and declared monkeypox a global health emergency. There are more than 16,000 cases across more than 70 countries and more than 2,500 cases in 44 states in the United States right now. This declaration could push the U.S. to also announce a public health emergency. Health and Human Services Secretary Javier Becerra says that we should be very concerned.
We should absolutely be concerned, 100% concerned, because we've not had monkeypox the way we've seen it now, and we don't want it to become a part of life the way we're seeing. And so we have to stay ahead of it, and that's what we've been trying to do since day one.
Dr. Daniel Fabui joins us now. He's an ER physician in Washington, D.C., also a former Obama administration biodefense and public health appointee. Dr. Dan, it is great to see you as always.
Hi, good afternoon. How are you?
I'm great. So, Dan, here's the thing. We were just listening to the Health and Human Services Secretary Javier Becerra really ring the alarm there. He was saying that we should be concerned. Do you agree with him? And if so, how concerned should we be?
We should be very concerned. Our lackadaisicalness sometimes, and sometimes where we kind of become overconfident about things not spreading, then we undermine the public health response because we don't raise the alarm enough for people. But you also don't want to scare people, so it's a very difficult job to balance that message. But I do agree, it is concerning, as we talked about previously, that we would monitor the situation, and if we continue to see spread and it's magnifying, affecting children, you start to raise your eyebrows and have more concern. So I do agree.
So now that the World Health Organization has called this a global health emergency, what are your thoughts? I mean, should America follow suit and do the same? And if so, what does that really mean for Americans? We're still in the middle of this COVID pandemic.
A great question. I mean, Americans, as I've always said, we have other things to worry about. Let the public health officials worry about that. But I think it's also a time to raise the alarm for the public health officials, our Congress, people who hold the purse in terms of finance, in terms of investment, in terms of therapies and treatments, as we know we have in the strategic national stockpile, and how do we have adequate supplies, or what we call medical countermeasures, for people should this actually escalate to the point of almost like COVID. I don't think so, but at this time, once we're seeing these signals, we need to be aware of that, and we need to be on the job. We, meaning the collective health officials.
I mean, these are great points that you're making, Dr. Dan, because you used an important word earlier on. You said the U.S. has been somewhat lackadaisical, and we all saw how the response was to COVID when COVID first hit the U.S. So do you think that we're prepared? Do you think that we've learned any lessons from the way the United States handled the COVID virus? And I think that you touched on it a second ago. Do you think that this could become another pandemic if we don't act now?
Yes. I'll put it that way. That's very simple, because we cannot be complacent. We have to address these issues. I mean, monkeypox is scary for a lot of individuals. It's a cousin to smallpox. You see what those lesions look like. People see this, and it can be scary, disfiguring. Yes, it does resolve 2 to 4 weeks, but there's some people who may have complications from it, but also just disfiguring, the scars, the healing. All those things are psychologically damaging to people. And yes, so I think we need to be on the ball, and we need to learn those lessons. We haven't learned. We never have learned, to be perfectly candid. It's one of those things, what we call the lessons we experienced. We just is like, oh, we got another bug. We got another infectious disease outbreak, an emerging infectious disease in that category. There's so many things out there. And other things for the public to worry about. But it's the pressures on the public health officials and congressional members, people who hold the purse and the finances, innovators and leaders, to listen to those different therapies and innovation, and also how we can manufacture on scale these things to make sure there's equity among vaccines and treatments, so we're not re-experience the lesson that we should have learned before.
Right. So we've covered COVID. Now we've covered monkeypox. And a few days ago in New York, a man was diagnosed with polio. What does our future look like? I mean, could we be dealing with all three at the same time? You've touched on monkeypox and how concerned we should be. What about polio?
So polio is a different beast in and of its own. And based on the case that did occur, there's some endemic areas where polio hasn't fully been eradicated. So that is always a risk due to travel and all those things. I don't think in this case we're worried about a pandemic of polio. But this also raises the question about vaccination within certain communities that aren't really willing to accept vaccination. This is what happens when you have a pocket of a group of people in certain areas who are not willing to get vaccinated. And then they put other people at risk. And it's not bad-mouthing any group. It's just one of those things that we have to quickly jump on. So contact tracing, finding exactly where it spread. And I think there's some other questions that were about, did this person receive oral polio vaccine, which is known to actually cause polio-like symptoms because of the shedding in the feces that end up getting spread when you have oral polio. And that's why we don't give it anymore, at least in the States.
Probably a great time to make sure that all of your vaccinations are up to date. Dr. Daniel Fabui, it's great to see you. Thank you so much for your time and expertise, as always.
My pleasure.